Okay, welcome. My apologies for being late. This is Dr. Kasia Kynes, founder and CEO of the Global EBV Institute. So today we're going to talk about medical conditions that are driven by EBV. So if you would like to go back to last week's call when I discussed symptoms and common complaints that people have, presentations, that's available and recorded. Today we're gonna call names. So I can go through, the whole body scan from up here all the way, and I will miss a lot of conditions, that's for sure. And so a couple of pointers that I want you to kind of zoom out and understand. The virus doesn't stay in your bloodstream. It travels and it gets into your B cells or T cells, your inside, infecting inside your cells, your immune cells. And hello, Michelle. And glad you're here. And so it'll travel. I always say that, when you have a reactivation, the virus is kind of flooding your bloodstream, but then it's using the bloodstream as a taxi to deliver it to your organ system somewhere. So it's not going to be tracked very well long-term in your bloodstream. It's going to be in particular organ. So let's start with some simple things that are very common. Thyroid is very common. So a lot of women in America have low thyroid function. If you have low thyroid function or you've been told so, your immediate question for your doctor should be, can you please test me? Test 2 antibodies for Hashimoto's thyroiditis, which is autoimmune, because statistically, majority of low thyroid function is actually that autoimmunity, Hashimoto's. And that's very different. And your TSH can be okay still, it's just... So the reason why I'm saying that is because out of many causes of Hashimoto's, EBV is probably number one. And that's indirectly what led me to EBV, working a lot with women with thyroid issues, in particular Hashimoto's. So Hashimoto's is a common condition that can be brought by EBV. We can flip the coin and talk about hyperactivity in the thyroid. It's much less frequent, but it does happen. And that's called Graves' disease. And that's when your thyroid is working too hard. Hi, Robin. Welcome here to the training. And so that can also be induced by chronic EBV. So the thyroid can go high and low, hyper and hypo. And some people, it's not as frequent, but some people can have hyper and hypo over a course of time, just not at the same time. So don't be confused if somebody diagnosed you with Graves and then somebody diagnosed you with Hashimoto's. So thyroid is a big one. We may have liver problems. Liver is really impacted by EBV one way or the other. But in some cases, you can induce autoimmune hepatitis. Hello, Tim. Hello. And so liver may be a problem. In some people, there is pain around the mid-belly or on the side. That can be spleen. Spleen can be enlarged, and that's very clear, black and white presentation of EBV infection, acute. And that's kind of dangerous because spleen can rupture, and that's life-threatening. Spleen, for some reason, is maybe more common in young boys. Not necessarily, I've seen women with it in our community, but it's not that frequent. Let me see. Lymphomas. I've seen even tumors growing around the lymph. Let's move to the head. You can have viral encephalitis. So the virus can be the virus can be living in your brain. So, and people can have a lot of either inflammatory conditions related to the eyesight, They can be hearing loss. They can be virus encephalitis, as I said. You can have the virus in the vestibular inner nerve in your ear. And so sometimes people have ataxia, which is loss of balance. Or you can also have vertigo when you're spinning. And that, you know, your ears can buzz, or you can have ringing in the ear, that kind of related, sometimes pain. So it can attack your salivary glands in your mouth. You can have Sjogren's when suddenly everything is dry, your eyes become dry, your mucosa becomes dry. That can be driven by EBV as well. Lupus is classic for EBV. That's like classic chronic infection of EBV. Multiple sclerosis, we're hearing a lot about it. We've heard about it for years. There have to be a couple of other cofactors for MS, but one of them is EBV, and some researchers claim that you know, EBV is a prerequisite. You have to have that as one of the factors to actually develop MS. Let me see here. There is a laundry list, and we have a laundry list on our EBV help website as well. I bundled them in different categories. The chronic one, the classic one is chronic fatigue syndrome, because if you look at least research, we know in research there's a concept of chronic mononucleosis syndrome, and if you look at the chronic fatigue syndrome, they really overlap. So I think if you had a mono that was really bad, and after that mono, it's like the worst flu in your life when you were bedridden, and after that, you actually never go back to baseline. Your baseline is shifted, and you're just not quite what you used to be before it. That's where we see often this opportunity for the virus to go chronic, and it starts carving into your organ systems, becoming maybe chronic fatigue syndrome-like condition. Sometimes we also see fibromyalgia, but that's more complicated. It can be components of EBV. I've also seen cases of connective tissue disorders, and let me read you more. I mean, there's hypotheses about Parkinson's disease. Let me see here. Rheumatoid arthritis, especially juvenile, idiopathic juvenile rheumatoid arthritis. This is a case where you grow up and you have this weird rheumatoid arthritis, and doctors don't understand why, where it comes from. They call it idiopathic. That's directly caused by EBV. There's some studies on atherosclerosis. Celiac is interesting. Celiac can be triggered by EBV. There's one particular study by Dr. Harley. When if you have the genes for celiac, EBV can turn that gene on, basically. So that's why in our community, getting off gluten is really important, even for just that reason. And all kinds of myalgia, so all kinds of chronic conditions related to pain in the muscular system. Diabetes type 1 has been directly linked to EBV. Scleroderma, glomerulonephritis, that's the autoimmune infection of the kidneys. Now let me pull out, because there's so many more, let me actually pull out my website, and I'll quote you some more and tell you some more stories, because we see so many different conditions, and sometimes it's a bucket full. And you know, when you have a bucket full of medical conditions, and you're not responding, you're trying everything and you're not getting better, this is when you should consider that it's actually driven by EBV. There's a high probability. And so if you're trying to tackle individual conditions, you're gonna go in circles. Okay, so we have a website page called the related EBV and related conditions. If you go to that website, I have everything referenced, so you can click on PubMed and read some studies. So what have I missed? Inflammatory bowel disease, whether it's ulcerative colitis or Crohn's disease. If you look at studies, they suggest that about 60% of triggering events in both of these diseases come from EBV. Dermatomyositis, Guillain-Barré syndrome, that's a rare syndrome, glutatate psoriasis. You get into those weird autoimmune conditions. Immune thrombocytopenic purpura, polymyositis, psoriasis, mixed connective tissue disease, I talked about that. Idiopathic thrombocytopenic purpura. We talked about brain inflammatory conditions, meningitis I missed, acute disseminated encephalomyelitis, cerebralitis, myelitis, cerebral ataxia, I talked about that. Even schizophrenia, there are some links. Let me see, gastrointestinal, OEC, GERD, sometimes duodenal ulcer, dyspepsia. I often see co-infections with H. pylori. Co-infections are common. Let's talk about some cancers. There are kinds of cancers that are linked directly. Some are indirectly. There's some hypotheses, some new studies. Here's what we know. Hodgkin's lymphoma, Burkitt's lymphoma, nasopharyngeal carcinoma. Almost 10% of stomach cancers can be caused by EBV. Angioimmunoblastic T-cell lymphoma, leiomyosarcoma, papillary thyroid carcinoma. I've seen quite a few cases of papillary thyroid carcinoma when women will have a surgery or will have thyroid removed or radiated. And the problem with it is if you do that procedure, the virus is still in the system, so women continue being miserable. It's not, they didn't get the resolution. Malignant lymphoma of the thyroid, gastric lymphoepithelial carcinoma, B-cell, NT or T-cell tumors or lymphoma, non-Hodgkin's lymphoma, cutaneous lymphoma, transplant, that's disorders that are rare. Colorectal cancer and breast cancer. These are interesting types of cancer because they're starting to study EBV in those cancer tissues. And they're seeing, we don't have information yet that this virus causes these particular types of cancer, because that's not what it is. But it seems that EBV is more aggressive in those tissues and grows faster. So there's I think the EBV is an opportunistic kind of virus. So if there is a weak link, it's going to settle and grow. So that's probably what it is. We also have misdiagnosis. So sometimes people are diagnosed with Crohn's disease. If there's an odd presentation of it, the consideration is maybe it's not Crohn's, maybe it's actually EBV. The same with ulcerative colitis, polymyositis, Lyme disease. There's a little bit of evidence that you can have false positive for borreliosis, and that's actually not Lyme's. And there's also a laundry list, and I've been talking for 10 minutes already. You can have a laundry bucket of all kinds of inflammatory conditions, acute hepatitis, hypersensitivity to mosquito bites, genital ulceration, oral and mucosa cutaneous ulcers. And then I talked about the eyes, ocular inflammations. There's a couple: oculoglandular syndrome, conjunctivitis, dry eye, keratitis, uveitis, choroiditis, retinitis, papillitis, ophthalmoplegia, and bilateral chorioretinitis and optic neuritis. Polymyositis, recurrent epistaxis, which is nosebleeds, and severe low blood platelets. It's called severe thrombocytopenia. Yeah. So basically, if you look at medical literature, here's the conclusion. The doctors are told by medical literature, if you have a patient and the patient has chronic medical conditions and you provide the protocol and the patient doesn't respond, this is where you should consider testing for chronic EBV. Make sense? There's another study saying if your patient has complicated conditions that can't be explained, then you should also consider testing for chronic EBV condition. So let me see. I am finished talking. And let me see if you have any questions. I might be able to answer. But as you can see, there is a laundry list of conditions. And I remember finishing the book and a thought popped in my mind. Well, what about Crohn's disease and ulcerative colitis? Like, nah, that's a completely different sort of, issues. And I went to PubMed and looked at studies, and there are studies saying about 60% of cases may have started with EBV. And occasionally, I will get a client or a student in our community who will pop a new question. There was a question about interstitious cystitis. What do? I don't know. I haven't seen the cases. I haven't seen this complication within the context of EBV. But what will I do? I will go to PubMed and type in that condition in EBV, and they're pop studies. They're saying, well, there's association. Something's there. So you will notice whatever conditions you have, you can go to PubMed, type in that condition and EBV, and see what comes. You may be surprised. So it's a huge virus. It's like a big umbrella. So if you are miserable, you've done a lot of work, you've tried all kinds of diets, you've tried all kinds of medications, all kinds of protocols, you have all these diagnoses, sometimes like laundry list. That is a concern, So if you don't work on EBV, you're going to be going in circles over years trying to tackle one condition after the other, going from expert to expert on particular condition. So in that sense, EBV is simple because if we just do the EBV protocol, those conditions may no longer be an issue, which is amazing. So I'm going to go, I'm on the phone here, but I'm going to go to my computer and see if before I finish, let's see if there's any questions from you. This is the time to type them in. Let's see here. Okay. Is there a correlation between EBV and dental problems, Tim? Great question. So actually it could be. And in fact, to the point where I have a little dental piece in our library, in our program, in our training program, because we see a lot of co-infections. So I would say EBV is an opportunist. One of the things I mentioned is Sjogren's, where, the virus is in your mouth. You want to consider the fact that the virus, you get the virus typically through your mouth, unless it's through birth. And so the tonsils are a reservoir for strep or EBV. Larynx typically is where it happens. The lymph nodes get engaged and get swollen and inflamed. So all this is the activity of the virus, and then it can go into the brain, like we discussed earlier. So the mouth is a problem. So if you have any root canals, if you have any infected teeth, they have to go. You have to get them out, clean up, prevent any infections so you don't have co-infections. So there's a there's a common situation in people with chronic EBV. The term in medical literature is transactivation. It's been very well documented that when you have an EBV infection, you can reactivate other species, bacterial infections, strep, staph, a yeast infection, H. pylori infection, unrelated. And by the same token, if you have strep in your mouth or staph in your mouth or candida in your mouth, if you have an infection, that can reactivate your Epstein-Barr virus. So yes, the oral cavity is very important. You want to keep it clean. Any other questions? This was a great question, Tim. Robin and Stephanie and who is Michelle, let me know if you have any questions, type them in. And if not, we're going to finish the training, and then I will put a link to the website for you guys where we have the laundry list of all these conditions. And there is an entire chapter on these and the studies in the book. I don't see any questions coming. So in that case, thank you so much for being here live with us. This will be recorded and available here. And hopefully you will join me for our transformational workshop, which is coming in July. And with that, yeah, no more questions, Tim, just you. Have a wonderful day. Today is second day of summer, so I'm really excited about that. Love, light, and healing to you guys. And I'll see you here next week.